Good afternoon, and thank you for joining us today for today's session on addressing workforce challenges facing Lutheran social ministry organizations. This is part of our Strength and Service series, where we target the issues that are most important to our members in facing the uncertainties of the future and moving forward. And certainly workforce, which is the topic of the conversation today, is one of the #1 challenges facing our members across the country. I'm pleased to introduce our guest speakers, Jeff Tiemann, President and CEO of Portico Benefits Services, Ted Goins, President and CEO of Lutheran Services Carolinas, and Terry Rodriguez, President and CEO of Lutheran Ministries of Mercy. Portico is a strong partner of ours and is a ministry of the ELCA. It's one of the premier benefits firms in the country that provides a wide range and comprehensive service-oriented, affordable health services. Today, Jeff will discuss the results of a survey that Portico did of our members, which uncovered some valuable insights as to how they relate to health and retirement benefits, as well as what's top of mind for Lutheran social ministry organization leaders. Terry and Ted will then be sharing some of their strategies to improve recruitment and retention. And we will have time for Q&A at the end of the presentations. So please feel free to use the chat and ask your questions as part of the chat. We will get to them, and then please be ready with your questions afterwards. Jeff, I'll turn it over to you.
Well, thank you, Charlotte, and good afternoon, everyone. Thank you for taking time to join us today. We're really excited to share the results of this new research based on input from many of you. I hope that you hear valuable insights that could help you find ways to attract, retain, and care for your most important asset, your staff. I'm going to share the highlights of the survey. We'll send out the details after this. As you heard, you'll hear from two member CEOs talking about some of their experience dealing with these issues we're going to discuss. And then we'll finish off after the Q&A time with some perspectives from Portico Benefits Services about how to address those most pressing issues. The challenges of finding and keeping your workforce have never been tougher. We're hearing that over and over. And knowing that you, our partners, are facing challenges you've never faced before quite like this, our goal is to gain a deeper understanding so that we can share our resources to help you. And this is why we so appreciate the opportunity to partner with the Lutheran Services in America and all the leaders across the network to learn directly from you and see how you're leveraging benefits to help overcome these challenges. Learning from each other really is an essential part of leading strong organizations. Portico Benefits Services surveyed Lutheran social ministry organizations about their top organizational concerns and their views on the role of employee benefit program. Specifically, the focus of this research was to learn about current challenges social ministries face amid the pandemic, your perspectives on the role employee benefits play in helping leaders overcome challenges, and perception of benefit offerings, associated costs, and current benefit partners. Portico welcomed the opportunity to partner with Lutheran Services in America to connect with and learn from leaders across this whole network. Next slide, Chris. As we look to learn about the challenges currently facing LSA leaders, we wanted to ensure that we got a well-balanced view. And to that end, we sought feedback from the senior leader, often the CEO within each organization, as well as the financial and human resources leaders. So 3 different inputs. And as you might expect, there were many shared concerns across all the leaders that we got feedback from, but there were slightly different perspectives from each area that helped us get a broader perspective, and we'll dig into some of those results. The research revealed that social ministry leaders are first concerned with the well-being of people, the people that they serve, and the employees who serve within their organizations. I think that is expected and great news. They seek creative ways to attract and retain talent. Leaders are actively looking for ways to care for their staff, mitigate burnout, help them maintain their financial, emotional, and physical well-being. And not surprisingly, benefits play an important role in caring for employees. Next slide, Chris. Senior leaders agree that employees are both the biggest priority and the biggest expense for the organization. Challenges with recruiting, the Great Resignation, and mass retirement trends have leaders focused on keeping the talent that they have. People are the number one concern shared by CEOs, with recruitment, retention, competitive wages, burnout, and COVID topping the list of concerns. Leaders also see their overall employment model changing with the need to add more full-time and part-time employees and rely on staffing agencies for supplemental support. To compare, while CFOs say labor and benefits top their list of cost drivers, CEOs see overall staffing issues, including burnout, recruitment, and retention, as areas to address. Improving recruitment and retention could lead to higher labor and benefit costs. The key will be balancing cost with the need to keep employees happy and healthy at work so that social ministries can effectively and sustainably carry out their missions. Next slide, Chris. From the CEO perspective, here are the top challenges that come with the changing employment model: adding full-time employees, occasionally relying on staffing agencies, adding part-time employees, and increasing hours for those part-time employees. Leaders are thinking creatively to maintain sustainability. Now, in light of the current challenges, leaders are looking at different business models, creatively thinking about forming alliances, utilizing space differently, changing service levels, and considering mergers and acquisitions to maintain sustainability. Here's an interesting one. 37% of CFOs say their organization is not sustainable for more than 3 years without significant change. Let's compare some different perspectives. Both CEOs and CFOs are looking at new ways to leverage their core capabilities and add services. Strategic alliances would allow or could allow them to do both. While only 21% of CEOs are considering a merger or acquisition, 50% of CFOs are considering the solution. Because over a third of CFOs say their organizations are not sustainable in their current form for more than 3 years, that might explain why more would consider a merger or acquisition. So let's pause and ask, what action can you take from what we've learned so far? Examine your current HR and benefit systems. Organizations embarking on a merger or an acquisition will likely see an effect on the entire organization, but especially on human resources teams, as they are tasked with more onboarding and the potential need to manage multiple plans, benefit providers, and carriers during a transition. Before beginning a major organizational change, it's a good idea to audit your HR and benefit systems to be prepared for success and to avoid disruptions. Next slide. With staffing and organizational changes named as key priorities, leaders see benefits playing an important role in the overall strategy of their organizations, as well as within their recruitment and retention efforts. Much like creative business strategies, many CEOs are also considering new, innovative, or additional benefits to help address staffing challenges. A finding consistent with other industries, as 8 in 10 employers in general across the country are planning to increase the range and/or level of investment in employee benefits because of the impact of COVID-19. CEOs and HR leaders both see improving benefits as a way to enhance employee recruitment and retention. National data is consistent with these findings. In a recent survey by Fidelity, 92% of respondents expanded their support for programs addressing issues such as stress management, sleep improvement, and resiliency. While 88% of CFOs list benefits as a top cost driver, you must also consider the costs of employee turnover and onboarding in their overall calculations. So, what action can you take? If you're not already doing this, consider total compensation statements. A best practice for employee retention is to provide total compensation statements to show how you invest in them, including any wellness benefit you provide to employees. These statements can help your employees understand the full value of your benefits and see that you are investing in caring for their total well-being. Next slide. We have heard very clearly costs associated with benefits are a top concern for leaders. Social ministry leaders understand the value of benefits and see a strong benefit package as a powerful way to mitigate their staffing challenges, but steep or uncertain annual cost increases and lack of resources to administer these benefits have them worried. Across the board, senior leaders believe that the ROI of benefits is most effectively measured by employee retention and to a slightly lesser degree by employee recruitment. Universally, senior leadership is concerned with the rising cost of benefits and with the uncertainty around annual increases, with 100% of the CEOs and CFOs placing high importance on the total cost of benefits to employees. Efforts to contain costs will continue to be a top priority as leaders look to leverage benefits more deeply to attract, retain, and support employees. Next slide. What leaders are saying. The top concern with benefits. Here you see the list. So the question is, what action can you take? You should know, how do your benefits measure up? What do your employees think? Consider conducting a satisfaction survey to learn how employees feel about the current state of their benefits. Do employees feel their benefits are affordable? Are they comprehensive? Are they competitive? Do they feel their benefits demonstrate that their organization values them and is willing to support them with a benefits package that fosters wellness? Next. Most of the surveyed organizations want to reduce the number of vendors used. Most currently work with multiple benefit partners, which they worry is placing significant administrative burden on internal resources. CEOs and CFOs are both concerned with managing multiple vendors and the cost of administration, but less than 40% of CFOs indicate that they outsource benefits administration. The risk of overwork and burnout is a pain point not just for HR, but for the top level of the company as leaders look to alleviate stress and increase employee retention. So what action can you take? Consider how to support benefits administration. Are there functions that could benefit from an outsourced benefits administration approach to increase process efficiency while also protecting the capacity of your HR team? In terms of time, money, and employee satisfaction, how much is in-house benefits administration costing your organization today? Next slide. The pandemic and its related challenges have made it even more difficult for social ministries to remain viable, attract and retain employees, and serve their missions. As leaders explore new organizational strategies, they must remain focused on caring for their most valuable resource, their employees, while controlling costs. Portico can help you do both. As the nonprofit benefit ministry of the ELCA, Portico brings together over 47,000 participants across health and retirement benefits and negotiates benefits for the collective group. This strength in numbers helps employers increase their buying power, decreases their administrative burden, and better care for their employees. So that's the highlight of the research. And again, as a follow-up, we're going to send you the complete research. But I want to now switch and turn to two of your colleagues to hear how some of them, how they're addressing some of these challenges and give you an opportunity to ask them questions as well. So let me introduce Terry and Ted. Terry Rodriguez serves as President and CEO of Lutheran Ministries of Mercy. Terry provides executive leadership to Filling Memorial Home of Mercy, Luther Home of Mercy, and Lutheran Social Services of Northwestern Ohio. Terry attended Owens Community College and obtained her associate degree in law enforcement. She also attended the University of Toledo and obtained her associate degree in social work, bachelor's degree in human services, and a master's degree in public administration. Terry obtained her state of Ohio licensed nursing home administrator's license in 2011. She began her career at Luther Home of Mercy in 1989 as the volunteer coordinator. She was the director of public relations and development from 1990 to 1997. She was promoted to the position of assistant administrator of community ministries in 1999 and later became the chief operating officer in 2009. So welcome, Terry. And Ted began his career in long-term care as a nursing assistant on the front lines and was a certified nursing assistant for 20 years. A graduate of Lenoir-Rhyne University, Ted is a licensed nursing home administrator and served at Trinity Village in that capacity for 10 years prior to being named president and CEO in 2000. He has served as board chair for Lutheran Services in America, on the North Carolina Legislative Study Commission on Aging, on the North Carolina State Board of Examiners for Nursing Home Administrators, and on the board of Leading Age. He is currently on the board of Lutheran Immigration and Refugee Service, the editorial board of the North Carolina Journal of Medicine, and the board of the North Carolina Health Care Facilities Association. Welcome, Terry and Ted. Wow, what a great set of backgrounds and resources. So let's start off with our first question. What innovative approaches have you used to impact recruiting and retention of new staff? Terry, why don't you kick us off?
Thank you, Jeff. I think some of the most innovative things that our agencies have done, particularly in the last 18 months, was really to examine very closely our recruitment methods and strategies. And what we learned from that is we really were not reaching out to a lot of minority and ethnic communities within our geographic area. So we began to, certainly like many of you, increase our marketing dollars, our recruitment advertising dollars. But we really looked at sources of where were we recruiting, where were we not recruiting. And so we began to reach out in various languages, both in print, billboards, full-page stories, in minority publications, which we had not targeted before, and also to our ethnic communities. We have in the area several apartment complexes that house many members of particular ethnic communities. So we made contact with them as well. And that has proven very successful for our agency. I won't say people are rushing in the door, but I will say that we're seeing a slight trickle, and it does seem to be making a difference.
That's really great, Terry. Terry, just a quick question. Were these communities that you were getting new employees from, or did you already have some employees and some connection to those communities?
We had very little connection with those communities. So okay. Yes, something new.
So it was really starting from scratch, and you've seen some returns already. Ted, how about you?
Can you hear me okay?
Yes.
Very good. Yeah, and I thought I might mention, as far as innovation is concerned, and certainly along the same lines as Terry, we've always had a good nonprofit culture in the organization, but we felt like we needed something that was a little flashier. And just a few years ago, matter of fact, right before COVID, we finished up we looked at the Disney model and we looked at the Ritz-Carlton model, but it was always somebody else's model. And we just finally decided that it would work better for us if we could just identify the people in our organization that do things best and try to get that on paper and then get the rest of us to do it the way they do it. And so that's really what we spent probably a year just before COVID putting together, had just rolled it out and really had kind of rolled it out across the organization, and then COVID hit. And I'm so thankful, because I just can't imagine where we would have been through COVID had we not at least started that. We called it, because I'm not very creative, it's the LSC way. Lutheran Services Carolinas, the LSC way. And one of the things, when I'd see somebody smiling and I'd say, what are you smiling about? And they'd say, it's the LSC way. And it just, it let me know that people across the organization were starting to feel that way and get it. And again, it's just, it's what we've always done. It was just trying to put it on paper. We rolled into that our justice work and our DEI work, diversity, equity, and inclusion work across the organization. We added another component to it that was the plan from the beginning, but right during COVID, that we named extreme leadership. And really that was aimed at every employee, because we're all leaders, whether you're a nursing assistant or a dietary aide or a director of nursing or a social worker, you're still a leader in our organization. So really to kind of push that idea of extreme leadership across the organization. But we also tied in that some supervisory training, and we're not done yet. We've still got more of that to do, but all the statistics say a lot of people most people leave their job specifically because of their supervisor. And I don't want to be that supervisor, and I don't think any of us want to be. So we're really working on becoming better supervisors to all of our people. And the only other, I'm not feeling very innovative today, because we're all so under the gun with what we're all facing now with this workforce shortage. But we also added a kind of a recruiter organization in our corporate structure, and started our own pool. And part of that recruitment was just to take some of the load off the facilities. They're just trying to take care of residents in our group homes and in our nursing homes, et cetera, every day. And so at least it got them, it frees them up a little bit. So we've got somebody here, actually 2 people now, that are recruiting for the whole organization. And most of our facilities have just said, go ahead and hire them. So our people are actually doing the interviews, using virtual for a lot of that, and then basically they just show up at the facility for the things that are hands-on.
Well, that's great. Ted and Terry, what strikes me about what both of you said really is innovation in a time of need or necessity. And yeah, on one hand, the crisis mode keeps us from feeling like we can innovate. On the other hand, it's just remarkable to see how many things have changed so quickly. And Ted, your last example of why don't you just hire them for us? That trust across the organization, I think, must be part of that, the LSC way that allows that trust to be built. Are you using the LSC way publicly as part of your recruiting? Do people see that right up front?
Yes, we're trying to, and we need to do a lot more of that. But yes, we need to do more, because that's one of the we can't offer the highest wage or the best benefits, but we can offer competitive, hopefully. And then what you get on top of that is that LSC way, working for a cause, not a person.
Yeah. So Terry, if somebody not in Ohio competing with you wanted to leverage your good idea about reaching my communities that you might not have reached before, what would be some of the things that you'd suggest in terms of how to start there?
Well, I think for us, we really needed to evaluate who we wanted to target, who was in our geographic area. And we looked at a lot of census data and began with that. In some of our operations, the areas surrounding some of our operations, we had a large number of people in the Latino community, a large number of people in the Islamic communities. So that's kind of where we started. And then we actually contacted publications that targeted those particular groups. In this area, there's a newspaper called La Prensa, which is pretty much a Latino publication. And we started not only recruitment advertising, but stories in those publications about, this is what it means to do this kind of work. And this is something that, you're going to get a lot of personal joy from, and showing people how they can connect with our ministries. And the other thing I would say is that we really needed then to step away and look at our internal policies and procedures to see if there were things in our hiring process that were barriers to the people in these communities. For instance, in our Islamic communities, they were willing to come on board, but they needed specific times to be able to step away for prayer. Well, that certainly wasn't in our policy or procedure anywhere, but could we do that? Yes, we could do that. So then what kind of reasonable accommodations can we use to not only recruit these folks, but retain them?
Excellent.
Mm-hmm.
You know what really impresses me about what both of you have just shared is some deep preparation. Tara, you talked about really doing the research, the demographics of the people, and then how to get to them. And then Ted, you talked about the research that you did. You looked at Disney, you looked at Ritz-Carlton, and then you said, we're going to just do research on ourselves, and then we're going to write that down. And that deep understanding of your environment, internally and externally, has served you both very, very well. Let me move on to another question. I'd like to ask you, and Ted, I'll start with you this time. How are you thinking about strategic alliances and partnership to address the challenges you face today?
Yeah, and I'll hit that in a couple of different ways. Strategic alliances with lowercase letters, and then with maybe uppercase letters. As far as the smaller case, we've got about 1,800. We used to have about almost 2,000. We were right at just under 2,000 employees. But of course, with the workforce shortage, we're at about 1,800 right now. But they were scattered in all these different programs and in a number of different corporations. We actually created our own PEO, or professional employer organization, where we could put all of our employees in one bucket and get some different benefits out of that, instead of having them. Now they're seconded out to the same programs they were working for, but they're all essentially in one corporation. We partnered, if I can pander to Portico a little bit, we partnered with Portico on our 403. We had a 401k and just did not have the customer service that we really needed. And so we rolled that into a 403b with Portico that has been because of the customer service side, especially, and your professionalism, we've got a much better product that's helping. And we're looking for those kind of partnerships too in all of our benefits, to be able to do the job better. And then the other thing in strategic alliances is really looking at that scale. We years ago, when I started in this job, we had 3 nursing homes. We just felt like we either had to get out or get bigger, that we just couldn't stay at that size and survive. And then the other things kind of get added onto that. So we've grown now to 8 skilled nursing facilities, and then some other independent living and things like that, to give us some more scale and a little bit of diversity there. But I agree. I'm probably one of those that said we can't make it this way for 3 years, for more than 3 years. We're always looking for that merger acquisition collaboration that's going to allow us to have more scale to be able to do the things that we do. I mean, if you're competing with somebody that's got 50,000 employees and we've got 1,800 teammates, then obviously we can't work on the same scale. And I don't want to ever be that big, but I really do think we're going to have to continue to grow to continue to compete, and it's just going to get harder. So we're going to have to even do better in that regard.
Thanks, Ted. Terry, how about you?
The Lutheran Ministries of Mercy was actually formed out of a strategic alliance that occurred in 2013. So in 2013, Lutheran Home of Mercy and Filling Home came together to create this new corporation. And the purpose of LMM at that time was really Administrative Service Corporation that would serve both agencies. In 2015, the third Lutheran agency in Northwest Ohio came on board as a partner as well, and that was Lutheran Social Services. So today, under the LMM umbrella, there are 3 separate agencies, but there's an administrative service corporation called Lutheran Ministries of Mercy that serves all of them. That's why, Jeff, like in the intro, you said I provide executive to leadership to 3 organizations. That's why. But we have centralized IT service, fiscal services, facilities management. We'll be adding HR a little bit later on. And you know, we started in 2013 and lo and behold, it really worked. Save us dollars, you know, and now as we're, you know, just into 2022, I mean, when we look back and it's not a difficult thing. It's not an easy thing to do. It's quite difficult, but it has saved our 3 organizations millions of dollars since we first took that first step in 2013. And at this point in this trajectory, we're actually taking on a couple additional business partners who will not be affiliated under the LMM umbrella, but will contract with our Administrative Services Corporation to provide things like IT and accounting services. So it has worked. It has worked. And we're seeing other organizations, nonprofits in Northwest Ohio and really across the state start to consider similar things. So.
That's good. One of the common themes I hear from both of you is that idea of being open. That I've heard you both, you know, taking a step and being open to what that might lead to next. Because you know it's you know we hear people say that you can't do strategic planning today like we did years ago, where you could just map out a 3-year plan. But on the other hand, you can prepare for those possibilities and then be open to them. And I can just hear in both of your comments how that has grown over time, that you're open to those partnerships. And you know, Terry, it's, you know, you think about what if you hadn't done that, you know, the millions that you're saving now. I mean, you just like, okay, we just could not run the way that we used to run before. And we'll probably be saying the same thing 3 years from now as we look at the changes we made over the next 3 years. Great. All right, well, let's move on to the next question. And again, if you have questions that you want to chat, feel free to do so here, or we'll have I've got a couple more questions and we'll have a general time for questions too. So next question is, what innovative approaches have you used to care for your staff? And Terry, why don't you lead us off?
Well, I think our ministry has done quite a bit, particularly in the last couple of years. I mean, certainly throughout those pandemic months, we provided food pantry and personal needs services to some of our staff who needed those things. It was not uncommon for somebody to run to a grocery store and take somebody who was sick with COVID, you know, a week's worth of groceries and those kinds of things. But I think long term, one of the best things that our agency has done was really to become involved in the employee resource network. And the employee resource networks are a national program, and I think right now they operate in about 13 states. Ohio is one of them. And this is a group, in our case, this is a group of 6 businesses that came together and hired what we call a success coach. And we all pay a share of the success coach time. So for an individual agency, that cost is right under, for us, about $20,000. And the success coach comes to our ministries, and they're involved in our orientation groups. They speak to all new employees, but they work with all employees, and they work with them on the employees' barriers to successful employment. So I think some of the biggest issues our employees face, housing is one of them, transportation, access to government benefits, childcare, all things that get in the way of them coming to work, staying employed, being successful in the workplace. And so the success coach, while not an employee of our agency, works with them just on an individual basis to help them navigate all those life issues. And it's really been an amazing thing. And I think one of the successes of this program is because this person is not an agency employee, our staff don't feel like management knows what's going on in their lives, because many times they don't want us to know that they're having those struggles. And the success coach will come back to us, to our leadership, and say, you know what, your staff seem to be having a problem with this policy or that policy. It seems to be a barrier for more than one person. Can you look at that? And so that's been a great way for us to get a little bit of a heads up on something internally that might be preventing people from being successful. I think across the nation, the return on investment for success coaches is about 400%. We haven't experienced quite that, but we estimate that the cost of average turnover from one employee is about $4,000. So our investment in the success coach is under $20,000. We don't have to keep a lot of people to make a return on investment there. And it's also another way that our ministries are reaching out to show our staff that we really do care for them. And we're concerned not just about their success at work, but about their success in life. And so we love the program, and we would certainly recommend that to anybody who was able to take part in something like that.
That's great. It's a great way of showing that you really care for the people, and you can relate it then to dollar benefits that impact the effectiveness of ministry. Ted, how about you?
Just a few things. I think the biggest thing for us, and again, it's the LSC way, is to be flexible. So all of a sudden, all those things that we said we couldn't do, that we're finding that by golly we can. Things like 12-hour shifts or 4 10-hour days. Or working from home. And I know we're all facing all those issues. But all of a sudden, instead of saying you got to be here in the office, well, with COVID we couldn't be. And all of a sudden, it just changed our world. I know a lot of people are going back. Everybody's got to make their own decisions on that. But a lot of our folks, I've told them, I said, I hope I never see you again. And I don't mean that ugly. I just mean if I trust you, I know you're doing your work. And if you can do it from 45 minutes away and not have to make that ride, or not most days, then more power to you. So I think that flexibility has helped a lot, and it's opened our eyes certainly in a lot of different ways. Sometimes it's the little things. Early in the pandemic, and we used some of our COVID relief funds for this. Obviously, like everybody else did, bonuses and bonuses for people picking up extra shifts for working on COVID units or with COVID residents or clients. We've done all those things. I suspect everybody has, but sometimes it's the little things. A person that we use for some of our dietary as a dietary specialist, he led the effort, and we started sending home a bagged meal with each employee. And it might be something as simple as one of those big family cans of soup and a sleeve of crackers in a brown paper bag. 1 week it was and we did it kind of on a weekly basis there for a while. It might have been a bag of snacks, some candy bars, and so the children are bouncing off the walls, and some popcorn, things like that. you know, as simple as that was and relatively inexpensive, you know, we care about you and your family. That's the impression that it gave people. And it's not just an impression. I mean, we really do, but it was that people could actually see that. I love the idea, Terry, of the success coach. I want to learn more and talk about that. I've got a book laying here. Very well. It's kind of the other side to your success coach. And many of you, have y'all seen the book Dream Manager? Some of you, there's at least one shaking of the head. I've got that sitting on my desk because I'm just enamored with the concept. Now, I'm not sure we're going to be able to do it exactly like the book would ask for it, but it's, you know, it's actually the opportunity, and it sounds like some things that I know Terry's doing and that Portico's doing, but where you're actually working with your teammates, your employees on, you know, what is your dream, and how can we help you? How can we partner with you in seeing that dream come true? And I just love that, because again, it just takes employment to a whole nother level. And so we're looking at how we can implement that, at least that concept, into what we're doing now.
That's great, and I'm sure you'll make it your own. So, all right, these are awesome innovations. Let me move to the last question, because I want to leave time for questions from other participants. So my it's a pair of questions. How are you using benefits to address workforce issues? And have you added or considered adding new benefits to be more effective there? And Ted, why don't you kick us off?
All right. And you know, that this is a tough one for us, because it seems like I've got, you know, half of our workforce doesn't want any benefits at all. They just give it to me and pay, and you know, let's move on down the road. And then the other half that are really looking hard at your benefits are not as competitive, and we've got to do better. And of course, you know, we live and die by Medicaid in our organization, which makes it very hard to be as innovative as we would like to be. But that just means we have to work harder. So you know, we do feel like, and we've added some things along, and maybe not added, but improved, I guess is more the word for, like our employee assistance program. You know, COVID has really highlighted that we can't just, you know, it's not like in the old days where you said leave your problems at the door. We've got work to do. You know, clock in and go to work. I mean, we get the whole person, and we always have. We just ignored it for a lot of my career, frankly, and I've learned, I've certainly learned that lesson too in the hard way. But we've got to help people with, you know, with whatever issues they face, and if that's a physical issue through their health insurance or through mental health services. We've improved our mental health services, the employee assistance program in general, up in our, but we're looking at and have, you know, everything from more time off, again, that flexibility, looking at our 403B match now, because ours is very low compared to the world. And again, when the people that want benefits are certainly looking at those things. One that we have not figured out that we're getting a lot of pushback on these days is childcare, you know, support for childcare and parental leave. That didn't make it into legislation, but that has not toned down as more and more employers are offering those type things. We've got to be competitive, and we got to find a way to be competitive.
That's a long list there, Ted. Terry, how about you?
I think one of the most important things that we have done in terms of benefits is really around mental health counseling and mental health services for our staff. One of our affiliated agencies is Lutheran Social Services of Northwestern Ohio, which has a very large mental health counseling program. So the staff from the other two agencies can obtain up to 7 visits free of charge before their insurance kicks in and the co-pays and everything else. But if they would like to to avail themselves of mental health counseling services through LSS. The first 7 visits are totally free for them. And we've had a large number of employees take us up on that offer. And we don't know if they're going or not. You know, we get a bill by number and we we pay the bill to LSS. But the feedback we've got on it is, particularly in the last 2 years, this has been such a highly utilized resource because the pandemic has just had such an emotional toll on people. And, you know, one of our agencies had 13 resident deaths due to COVID. And so the staff that cared for those residents, some of those residents had been within our agencies for 22 years. It was family who passed away. And then they had that going on at work, and they had illness and death in their own families. And so mental health of our staff is a very high priority at this point for us. We have looked at, you know, we have a nursing shortage, I think probably like many of you, and we have an existing tuition reimbursement program, but we're looking at what more can we do for nursing students. We have a lot of direct care staff, supported living providers who enter our organization at that level and want to do more in terms of education and want to be nurses. And so how can we move them up in that system and then retain them on our nursing staff of our agencies? So we're looking at that as well. And then I think thirdly, our healthcare benefits. We typically have traditionally started healthcare benefits at the 90-day mark. You know, once you get through your orientation, boy, there's your benefits. But people need it when they walk in the door. Very few can pay COBRA for 90 days when they leave one job to come to our organization. So we're certainly looking at shortening that timeline for the start of benefits for people. So,
that makes sense.
Many things we have to do, right?
Yeah, that's great. Well, we are so thankful you have shared a lot. I think we have time for like one question. If there's a question, Kim, do we have any questions? I know you've been watching.
Yes, Karen, would you like to unmute your phone line and ask that of the group? Thank you so much. Karen Joseph from Lutheran Services, Florida. Thank you.
So we get all the time from our hiring managers that say, you know, well, look at our jobs and what we pay, and they could go right down the street to Target or Walmart or McDonald's and make $15 an hour. How have you addressed, you know, keeping your jobs competitive when we try to compare to those for-profit companies like that?
I could chime in a little bit, Karen. I don't know that we will ever be as nonprofits as competitive wage-wise, benefit-wise as we would love to be. However, I think, you know, we as organizations, we make every effort to work within our budgetary constraints, primarily being funded by Medicaid. But I think culture, how we treat people is as important, if not more important. If we have a wage that's, you know, fairly good and we can bring people in the door, it's then how do we keep them? And we do that through culture and how we lead and how we treat our folks. And so to us at Lutheran Ministries of Mercy, yes, we need to remain as competitive wage and benefit wise as we can, but we also really need to focus on the culture of our organizations.
And I would just add, I agree completely. I would just add that I was hoping they would ignore your question, Karen, because it is, you know, especially for Medicaid providers. I mean, it's, you know, we just found out our current cost is $300 a day and our reimbursement is $200 a day without COVID add-ons. And so, you know, how are we going to even make payroll? You know, is really where a lot of us are in a lot of different states. So I think we've tried to just narrow the gap as much as we can, and then really play up our culture piece, because that's all we've got. You know, we can be a good place to work, and it's not the greatest answer, because I hear it every day. We've got a brand new Chewy distribution center here that just opened up, that's paying, you know, what you're talking about, $15, $17 an hour. and we just cannot compete with that head on.
All right, well, thank you. Okay, I think we got time for one more question. Kim, do we have another question?
I don't have a question, but I'm happy to share. We've implemented an employee referral bonus program that has been wildly successful, more than what our CFO thought he was going to spend on it. There are two conditions. The candidate, when they apply, has to put in the name of the person who referred them, who is our existing employee, and they have to successfully complete their probationary period. We track it. We started it in August of last year. We paid out to 44 individuals so far, and we have 34 more in the queue to be paid out. And what we found is the person who refers them has an investment in that person staying and being part of our organization. They have kind of a built-in friend and mentor. Now we'll begin to track how long do they stay, so we can compare it to retention for other. It's been more successful than other outside kind of recruitment platforms and efforts. So,
do you mind telling us how much you're paying?
We are paying $1,000 right now. If they refer someone, the person puts their name in and they stay through their probationary period. And the types of issues we're having with overall recruitment, that is money well spent with the time of our vacancies right now.
Absolutely.
That's great. Well, Karen, thank you for sharing. It's not often that we hear someone raise their hand and say, we're spending more than we intended, and we're happy to be doing it. So thanks for the
trying to keep it away from the CFO before he makes money. So.
Yeah, that's great. That's great. Well, I'm going to wrap up this section of our time together. And again, I want to thank Terry and Ted. We really appreciate you generously sharing what you've learned and sharing that with the whole network. You have a lot of wisdom, a lot of creativity, and it's great. Chris, if you could put the next slide up. I want to just close off and talk a little bit about Portico and our perspective on some of these issues as we've looked at the research. We know that our employers and members give themselves in service to others every single day. And in order to do this work well, you need to be healthy and well cared for, or you risk burning out. We heard about the increase, and you've seen it, the increased need for mental health care. There is a deep intensity to this work, and you have to be intentional about how you care for yourselves while caring for others. Portico exists to serve those who serve. Our service to them is our life's work. Their success is our purpose. And I would just throw in our recruiting and retention, having that clear purpose of why we exist is a key part of what helps us to attract and retain really great talent. Next slide, please, Chris. So Portico serves you in 4 key ways. Our total benefits platform, health, retirement, disability, life, whole person wellness, all in an integrated offering. Because we have the buying power of a large group of people, we can provide more stable costs and access to a wider variety of products and services for our customers. We are an extension of your team, providing administrative support services to you, engaging all members to provide education and maximize their use of their benefits. And as a nonprofit with faith-centered values, we provide benefits that serve your whole person wellness. We go to the next slide. I just want to introduce some of the key members of the Portico team. And so we'll start off with Ross Eichelberger. He has over 10 years of experience as a member of the Portico leadership team. And during his time at Portico, he's led many areas within our organization, including IT, benefits administration, and customer care. And the breadth of Ross's experience has given him a deep knowledge of our customers, as well as the overall experience that Portico delivers for client organizations across our products, services, and operations. This knowledge and experience is the foundation Ross is leveraging to enhance our efforts in our account management and business development teams. Christine Vitelli brings over 20 years of financial services experience to the Portico team with a strong emphasis on key account and relationship management. She's excited to leverage her experience to ensure that Portico delivers everything our clients want and need today and into the future. Will Stensrud brings nearly 14 years of experience working with clients to understand their unique situations and tailor solutions to help them overcome the issues they face. Will also bring significant financial services experiences to our team. And Christina Womack has been a key relationship manager across both our ELCA and LSA partnership for nearly 24 years. Her heart for serving others, combined with her deep knowledge of the products and services Portico offers, allows her to meet and exceed the needs of our clients. Next slide, please, Chris. So in closing, I would like to thank Ted and Terry for their willingness to share their challenges and solutions with the group. I'd also like to thank Charlotte and Alicia and the whole LSA team for their partnership on the overall research that we did, as well as supporting today's session. And finally, I'd like to thank all the leaders who provided your input to the research. I want to thank you all for taking the time out of your busy schedule today to spend an hour with us. And as your partner in the ELCA, we're here to help. We want you to think of us as more than just a benefits provider. We hold ourselves to a higher standard as your ministry partner. We'd be happy to set up a follow-up to discuss your organization's challenges and needs in more detail, and we would welcome the opportunity to share best practices that we've identified along the way working with clients like yourselves. Please feel free to reach out to me, and I think I'll chat my email address. Reach out to me or to Ross, and we'll get the right team together to sit down with you. And with that, I will turn it back to Charlotte.
Thank you so much, Jeff and Terry and Ted, for sharing your insights and experience, and for Portico for your ongoing support and partnership. We truly appreciate it. Also wanted to thank all of the attendees here today for participating, and make sure that you know that this is this is one of our early Strength and Service series in 2022. We will have a whole slate of different Strength and Service series, and we invite you to those. Please stay tuned for those. Some of those will be focused on workforce, since that is a critical issue, but we'll have a broader set of webinars as well. So again, thank you so much for participating, and please feel free to reach out to me, Alicia, or our team at any point in time. So thank you so much.
Bye, everybody.
Bye. Thank you, Jeff.